Time now for this week's Health Matters. Paul Critz with you, along with Lynn Szabo. But we're not alone today, Lynn. We have a guest. Who is our guest?
Ryan Butler.
There you go. Ryan, how you doing, sir?
I'm doing great. Thank you for having me out.
Let me get you a little closer to that microphone there for you. All right. So we're here to discuss what? Being sad this time of year, correct?
Yeah, seasonal affect disorder.
And why are you here discussing this with us today? In what capacity? Are you just sad, or is it?
I came here to dump all of my sadness and trauma. I figure I've heard you're the man to talk to and get some free therapy. So.
Here we go. Open up for us, Ryan.
No, I'm a newer to town. I work for United Indian Health Services. I'm a licensed clinical social worker with a background in substance use. I'm also an ASUDC, which stands for an Advanced Substance Use Disorder Counselor. So we can work with substances and we can work with mental health.
So he came in and Ryan came in this morning and just laid, what is it, LCSWASUDC?
Alphabet soup.
Yes, that's all after your name in the on the placard outside the door at UIHS, right?
No.
Probably not yet, because you're brand new to UIHS, and we've consulted on a couple of patients. I've been super happy to have you as a colleague, but also I remember mentioning this radio show and said, well, I was hoping that you could maybe come on and have a topic of your choice. And you said sad, like boom, like right there.
Yeah.
Because here we are in the middle of it. So seasonal affect disorder is actually, my understanding, is kind of a subset of depression, is what it looked like. And it seems to kind of overtake people in the fall, and it spontaneously goes away for the year about springtime. Or early summer. Probably a lot to do with light, but what are your thoughts on it? What can you tell us?
I mean, I think it's tied into, the lack of, we've got shorter days. We're not getting the UV rays. We're covered up. It's cold. Our skin's covered up. We're staying inside. I think it's also coupled too with, you've got the holidays that happen. That's not always the best time of year for a lot of people. Right. It reminds us of what we don't have at times. So it's kind of like that perfect storm of short days, cold days, everything's covered up. We're not getting UV rays, plus the, capitalism, and could be a lot of different things, right? If I don't have the money for gifts, I feel bad about it, and I get depressed. And a lot of us, how do we cope with depression? We drink, and drinking is a depressant. So
and that makes it worse.
Right. Yeah.
Right. It reminded, in my research this morning, it kind of reminded me a little bit of hibernation in a way.
Oh, wow.
Because hypersomnolence, so wanting to sleep all the time, hyperphagia, which means wanting to eat all the time. And my two favorite things in February. And, just kind of a lower metabolic output, just like struggling through the fog.
That's interesting. Like tying it, I wonder if it's like a vestigial hibernation. That's really
could be.
I gotta take a winter off, man. You're just gonna have to pardon me for a little bit.
I'm checking out till the DAFs come up.
How much is sad understood in that regard, just as far as what actual causes might be?
Well, yeah. I mean, you look at the statistics, right? And that's what the statistics show, is that, it is kind of like that hibernation. People aren't wanting to go outside. It's cold, right? And so the statistics back up the research. And, Lynn and I were talking earlier about, do you want to discuss the need for UV and new technology that might assist?
Yeah, I think we'll get to that. But it's a clinical diagnosis, so people usually kind of know what they have, although they maybe can't describe it. I see it in the context of the exam room. People are just done with winter by like, I call it February. I diagnose people with February. Because and usually in January, about this time, people have just kind of had it. It seems like everything is never ending. They're worried a lot of times. I'm taking care of mothers with sick kids, and they think their kid has got something terrible because the kid's been coughing since school started. And it just seems like it all of a sudden becomes too much to bear.
How much of its presentation in the exam room is like anecdotal like that? I mean, do you have actual? Is there a blood test you can administer that would give you
Most of it is, but like you reminded us, Ryan, you really should get some blood drawn. Just a small amount. I usually test thyroid is the go-to one. I usually test a CBC because somebody might be anemic.
And is the thyroid just indicative of basic metabolic rate? Is that what you're testing with thyroid? What exactly are you looking at with it? Because the thyroid to me is one of those organs, those bits of the body. I don't know what it does.
It's like the idle on a car.
Yeah.
Okay. Yeah. So like a metabolic rate sort of
If
thing.
your
Right?
idle's too low, then you're pooping out at every stop sign. If your idle's too high, then you are inefficient and wasting energy.
Right. And you're burning a lot of calories just sitting around, right? That kind of thing.
Right,
Yeah,
if it's too low. And I have seen people with mental illness actually have thyroid disorders that nobody ever looked at.
Wow.
And
Because they can kind of present as like manic depressive in a way, or bipolar, right? I mean, if you're changing.
there's a lot of details in between there and there. But so it's always good to get the blood drawn. And patients, I think, want that because they're really scared that something is bad wrong with them.
Sure. Well, I also think too, I mean, I know that I mean, like I said, it's kind of that perfect storm, right? Like you've got shorter days. We're stuck inside, right? You're being bombarded with, I mean, first it's you have Thanksgiving, and then it's right after that you're followed by Christmas, and and then you've got this Christmas madness where you can't even go to a grocery store because they're so packed and crowded, and people are just ramped up, and followed by New Year's, which is a big party day, and everybody, and so it's like I say, it's a perfect storm of shorter days, consumerism, alcoholism, right? Focused on heavy eating and heavy drinking and
an abrupt stop.
Yeah, and a massive letdown.
Like you get through that, and then all of a sudden, January 2nd, you're like, oh my God, it's just a short day.
It's all over.
And
all those days off from work go away for a while, and you're just like,
what am I looking forward to now? Yeah.
That wasn't what I hoped it would be.
Right. You just pissed off all of your family over dinner. And your relationships are broken, and now you're left to pick up the pieces. And
never stop. Will the rain never stop?
Right.
Yeah.
And then we have a sunny January. So I'm just
far.
does a January like we've had now, because obviously the torrential December and the atmospheric rivers, we hit New Year's and it just stops. And so we're back into that kind of, climate change sort of weird January where we're supposed to get like 8 or 9 inches and we're not getting anything.
Yeah.
Does SAD get better when you've got like a sunny, dry winter? Do you notice any sort of corroboration there?
I mean, I can speak for myself yesterday. I mean, I made sure and went outside and I was working in the yard and then I made sure to, take off my shirt and just sit in a lawn chair for a half hour, right? To let the sun, kind of just let my body absorb, right? And that's what I would recommend is if the sun's out, try to uncover a little bit and get some.
And get some when the sun is at its highest.
Yeah,
I think,
midday
in the sky, so around noonish, plus or minus.
Yeah, go walk on the beach or do some yard work. Force yourself to get outside of the house.
In the clinic though, is there? I don't know if this is too fine a resolution to ask for with this. Do you notice there being a difference in the presentation of depression winters like this?
Yeah,
like
you mean atypical winters?
No, I just mean like the winters when it doesn't rain so much. Is it a little better?
Oh yeah, it's a lot.
Is
better.
it? Do you notice that
I
in the exam room? Just the fewer cases when you've got more sunshine outside.
From the physical, I would say yes, both with patients and with staff. Because right now the staff I work with are all kind of like, this never end. What do you think with those?
No, I would agree with that. Yeah, right. Like the weather's better, and I mean it's all tied together, right? Mental, physical, it's all really just tied together. I mean, and so if the weather's nice, we're not inside with each other, we're not brushing up against each other, so your rates of illness, all illness, are going to go down, right? So yeah, absolutely.
How much of a situation like SAD or other syndromes similar to this, where it's, and I use that term right? Is this a syndrome? No. Okay. What is it?
It's a disorder.
A disorder. Okay.
Yeah. Seasonal affect disorder.
Okay.
Right?
Just so it's right there in the name.
Yeah.
So you've got how much require? I mean, do you guys work together ever? I mean, you coming from like the counseling side and you from the physical side.
Absolutely.
That's why Ryan's here.
Exactly. How do you interface to address a disorder like SAD like this with the patient?
Mm-hmm.
Well, I get the blood tests, I do the exam, and then I say, look, this is what I think it is. And usually the patient knows about it.
Yeah, right. You've got to feel it.
It happens every winter.
Yeah.
Right.
And then if I'm super concerned, I can go directly over to the side of the clinic where Ryan works. And
like an immediate referral right then?
Right.
Sort of?
I don't necessarily pull him out of patient care, but I'd try not to.
This guy's really depressed.
Yeah.
You got to get
stop knocking on the door, Lynn. Anyway, but he's super responsive to coming to the room and introducing himself to the patient, and then setting something up to maybe investigate the counseling loop. Okay.
Right. Yeah, and that's always part of the assessment, right? Like, how long has this been going on?
Right.
What patterns are you noticing? Is this something new? Has it just started?
Because it's not something you can just
cyclical?
pull out by itself. Like you said, it's all interconnected with all sorts of the whole being, right?
What are we doing? Are we drinking? If we're
Right.
drinking excessively, right? Like, what's our what is our social life like? Do we have a circle of support, right? So many factors that affect our mental and physical health, right? How are we taking care of ourselves? I mean, it's even diet, right? Like, what are we eating? What are we consuming? What are we, and so, yeah, that's, I like the relationship that I have with Lynn, because we just kind of go back and forth and like Lynn had said, like getting your blood drawn, make sure it's not your thyroid. Then I can also have a discussion like, hey, meet with a medical provider. Maybe we can just do a short-term antidepressant to get you through this time of year. And then, with assessment, hey, maybe by the end of when the days get longer, maybe we can just take it off and see how we do, right?
I think that begs the question then, what sort of therapeutic responses are available for SAD?
Actually, I thought this was interesting, if I could comment. So when somebody's in the midst of it, selective serotonin reuptake inhibitors, or what I call Prozac-like drugs, seem to be Prozac and Zoloft, which is fluoxetine and sertraline, seem to be the ones that are the most commonly used. But if somebody knows this is happening to them and they've seen it in their family, they're like, for example, my grandma has it, I have it, my daughter has it, you can predict that it's going to start, maybe around equinox, so fall equinox, mid-September. Then you start those people on Wellbutrin.
Oh, wow. Okay.
Before they have symptoms. So it depends on whether they're in the thick of it or whether they're anticipating it, and the treatment varies. But light treatment, like Ryan discussed, hugely important, and probably the preferred treatment. There's no real side effects.
Getting UV on you.
Yeah.
There's some very real side effects, but
depends on how long you sit in the sun.
Not here, not
here. No,
in the winter, and not for 30 minutes.
Right.
Yeah, I know. I hear Jesse Voss, our dermatologic PA, losing his mind now.
Oh, I know.
But
so is the light therapy? Is it just that simple? Just getting sunshine on you?
That, or even sometimes a vitamin D supplement as
Right.
well, right?
Yeah.
Like taking a vitamin D supplement in the morning when you wake up.
Right.
So take those people, because I can't tell you how many prescriptions I write for them and nobody's taken them. I've seen vitamin D levels as low as 1 recently. One. And
What should it be?
It should be 30.
Oh, okay,
low,
all right.
And then 150 is like, well, maybe you're getting too much. But so 9, 1, 12, that's all super common in this community right now.
Yeah.
Is there light therapy available that isn't just going outside here in the community?
I mean, not to I mean, I guess we'll plug. I think it's Sunseekers over there. There is a little.
Really? Is that all you need? Just a tanning
you
table?
can go to. You know, I myself, like, again. I mean, it's, you know, you're hearing a dermatologist roll over right now, but
Right.
I mean, I once a week just will in the winter just go sit in a tanning bed
Oh,
for
that's a
6-7
great tip.
minutes.
Okay.
You know, and you know. I'm British. I don't want to be all pasty. So,
Right.
so a little bit of, you know, there's a benefit of being toned, but also the, you know, fighting off the seasonal depression.
Yeah. Wow. Okay. Yeah, that's a good tip.
So yeah, you can buy on Amazon. You can buy lights that are specifically for seasonal affective disorder. But the problem is, their recommended times and periods of time that you use them are super inconvenient. So they say first thing in the morning for 2 hours.
Oh my God.
Yeah.
At a certain lower level of lights, or 30 minutes at a higher level of light. And I'm like, you know, my dogs get me up at 5:15
Yeah,
and I'm
yeah.
off and running. So there's no way I'm going to be able to sit still for that.
Right.
So, you know, maybe going outside and doing yard work, doing, you know, a task and absorbing sun that way is good. You know, there's also a little bit of forest bathing, I think, picks into this because when you're out there enjoying the trees and stuff,
Right.
you're also picking up sun. But I have found an interesting, I guess, direction that we might be going. They have earbuds. They're not really earbuds, but they kind of look like earbuds. That gives transcranial light. So you plug them into your ears, and your brain's getting the sun, because that's to go to the pineal gland, right, which is in the middle of your brain. We talked about the pineal gland, like, why do we even have one? But this is one important thing it does. And then, so you can wear these little earbuds for a certain period of time and kind of suntan your brain.
So that there's the old gag from like old movies in the 30s and stuff, where you've got a doctor or somebody pretending to be a doctor and they hold a candle up on the far side of someone's head and then look in their ear.
Oh, yeah.
And that's all I thought of when you were telling me.
Yeah.
Because
Yeah,
actually, no, that
yeah.
sounds
No,
really
it's
wonderful.
transcranial. You missed
Have
that
you ever
part.
done that?
Look through somebody's head?
No,
Yeah, with a candle.
shine the light through
Oh,
your. No, not the candle. Put the earbuds in and done the whole like on your pineal gland.
No, because that's experimental now, and I don't have
Oh, that
access
sounds
to
really.
that
I'd
technology.
love to
Yeah.
give that a shot. That's
How Doctor Who, you know? Oh, sorry, I was just sunning my pineal.
that's going to be a Coachella next year, right? They're going to be.
Oh, that'll be the new
Totally.
fad. Believe me.
Exactly.
Yeah, it'll be-
Kids are burning their brains out on these
Well,
things.
my hearing aids do a lot of things, but
You-
that's not one of them. But I do know when
Well,
the
there you
space
go.
station flies over.
$1 million idea right
Yeah,
there.
there you go.
Hearing aids that have UV light.
So other than the SRR, whatever those were, the serotonin reuptake inhibitors, the and
Prozac-like drugs.
the
yes.
Prozac-like drugs, and light therapy, what else is available for somebody?
Well, I mean,
It all seems it's like lifestyle
exercise,
stuff.
right?
Yeah,
Getting
sure,
exercise, going to the gym, trying
Yeah.
to, you know, and that's what I said. It's you know, you got to look at these different areas of your life, right? Like, what am I eating? Am I moving my body? Am I exercising, getting sun, relationships, right? Making sure, you know, I always hear from people, oh, nobody calls me. Well, are you dialing the phone?
Right.
Checking in on friends and maintaining relationships, giving people hugs, right? Closeness. These are all things that are going to stave, you know, like I said, healthy sex life, right? It's all things that are going to stave off depression. Right?
Yeah. Yeah, and that connectedness is always such, because I can get really curmudgeonly, winter or summer, doesn't matter, and I forget that. That connectedness, just as a human animal, you need that. That is as much a
Yeah,
need as
totally.
food and water. Yeah.
Yeah.
But anybody who's been listening to this radio program for a period of time, it always kind of comes around to this is the solution.
What?
You should eat right. You
Yeah.
should exercise. You should have meaningful, you know, relationships in your life.
So much comes down to like, I
Yeah.
mean, other than
Yeah.
the genetic, you know, roll of the dice, you know, your lifestyle just seems to be the key thing that you
Right.
can do for yourself to be happy and to live long.
Yeah.
Eat a salad every once in a while.
You know, what I'm saying?
I don't want to, but I force
Would it
myself.
like kill you to have some kale?
Yeah, I don't know. We don't need to go all the way to
Yeah,
kale.
let's-
right? There
Yeah,
are other
let's pump the
vegetables.
brakes here. I don't know. We gotta.
Well, there's certainly vitamin D. So take your
Yeah.
vitamin D. If your
Right.
provider's telling you your level's scaring them, then take the medicine. So
Yeah.
And basically, where we are, everybody's walking around with at least a borderline vitamin D deficiency, right?
Oh, yeah.
Oh, yeah.
Especially
Kind of
right
just
now.
generally, yeah.
I rarely see one that's normal.
Yeah, exactly.
yeah.
I think north of what San Francisco is
Right.
where the angle of the sun is just you're just under
Right.
the gun. Oh, yeah.
Right.
Well, sad season affective disorder. Anything else we can add here? We've got like 10 whole minutes left. So.
Well, the biggest thing, right? The biggest thing is reach out, right? You're not alone in this. Don't suffer in silence, right? If this is happening, if this is what you're experiencing, come see us, right?
Yeah.
Come down to United Indian Health Services or call any therapist, any clinician, get help, right?
Right.
Because you do see a big spike in suicide this time of year, right? And we don't want to lose our loved ones.
Yeah, no, and I don't mean to make light of it. I'm just sitting here having a good time being connected with other humans like you were talking about doing.
Yeah.
But yeah, there are people really, I mean, even I have really suffered in dark times, literally dark times.
I think
So,
it's worse right now. Like Ryan pointed out off mic, is the isolation from the pandemic really did a lot to. He was talking about the elder population specifically, but I wasn't aware of that. I thought it was really interesting, and it makes me think, everybody could use like a good time.
everybody
some way.
needs to
Yeah.
In some way.
Yeah, that's good.
Yeah, call your grandma, call your grandpa, mom, dad, whoever,
Oh,
right?
totally.
Just check in on them
Yeah.
because, we did see, upticks in rates of mental illness and suicide after the pandemic, right? We
Right.
were all living in fear of each other.
And isolated.
Yeah. And so it is important to, reach out and check on our loved ones, right? And yes, I mean the suicide statistics have changed, right? Like
Right.
the rates for the elderly have now taken over, right? It used to be middle-aged men,
Right.
but now it's the elderly that are committing suicide at rates higher than any other demographic currently.
What can
Right.
you suggest for somebody who might need to reach out right now? There's an 800 number? Or is it 899? Sorry.
Well, if you're in county, right? Yes, you kind of threw me. I'm new to
Sorry.
the area.
yeah, okay.
Yeah,
Well,
Del Norte County has a crisis team. I do
Right.
know that.
there's suicide hotlines. I think there's an 899 number where you just hit 899 and you can get connected to a therapist. In both Del Norte Community Health Center and UHS, your provider is a good resource there. If you're really dire and acutely dire, then the ER has people that are trained to help. So
It's,
even in Del Norte, there are resources.
988.
988.
988.
There you go.
988 is the
Right,
suicide
988. I was
crisis
just
line.
looking up
Thanks.
the. Well, I was trying to look it up, but let's have a real discussion about the internet service here, or the cell phone service in Del Norte.
So this is, I mean, an interesting
Yeah,
time to
988.
ask you, Ryan. You've been talking about you're new to the community. How long have you been in Del Norte now?
3 months.
3 whole months.
3
Okay, all right.
months
That's new.
yesterday. Yeah,
Yeah,
3 months
yes,
yesterday. Yeah, it's my 90-day anniversary.
As an LCSW ASUDC, what sorts of problems are you finding? Are there anything special to Del Norte that you've noticed, just mental health wise, that you've had to address? Or are humans just
huge
humans?
shortage, right? And there are no resources in place. I mean, there are resources. Don't let me say that. Don't let me back up. There are resources.
It's not a blank slate.
But not
Right.
enough.
Right, but yeah, there's definitely not enough, and that's a national thing. It's not just Del Norte,
Mm-hmm.
right? Like it's a national thing. There are a shortage of clinicians. They call us unicorns. So there is a shortage, but I'm still familiarizing myself. Trying to get my bearings here.
Yeah, yeah.
I don't feel like I've been here long enough to quite get a grasp of
Sure.
who the big key players are in all of this.
Where'd you come from?
Salt Lake City, Utah.
Salt Lake City, Utah.
Yeah.
Wow. All right.
Yeah.
That's a big difference.
Yeah, but I mean, it hits us there. I mean,
Yeah.
there we have, a lot of ice and snow. I mean, the skiing's phenomenal.
Yeah, right. You've
And-
got a reason to get outside.
well, and that's, but that's it. But I mean, you have to have access to resources to enjoy, that lifestyle. But, so yeah, what I am seeing here is like what Lynn has touched on is, you get these storms, the rain,
Yeah.
right? I did live in Seattle for a while too, so a lot of the same issues up there, right?
We get almost twice as much rain than Seattle does.
Yeah.
Really?
Yeah.
Wow.
Yeah. 40
But they have
inches.
less light, though.
Yeah, it happens all year round for them, right? And it's all
Yeah.
spread out for them. It's kind of always going on, but they get like 40 inches. That's a drought year here.
40.
I like to lord it over them like that. But yeah. The light is a big difference, and of course, being that much farther north, that also does something there too. But,
Sure.
But yeah. All right. Well, we've just got a couple of minutes left. If somebody has any sort of question about SAD or anything that they feel now for UIHS, you've got to be like members, right? Tribal members to take it. You're not
Native
just
or native related.
right.
Yeah.
Okay.
But Del Norte Community Health Center, they've got new providers in there
Mm-hmm.
and some really crackerjack new physicians there. Dr. Gordon, I'm looking at you. Anyway, so, and they also have, I think, a good counseling staff. I don't interact with them on the same kind of way I interact with Ryan, so I can't speak to him
Mm-hmm.
specifically. But they have always seemed to kind of have their counseling situation together.
Right. Yeah.
And they have a psychiatric RN who's
Oh, wow.
like amazing. I've heard her talk people down on the phone and
Oh
stuff.
my gosh.
She's good.
Oh, that's fantastic.
Yeah. So a lot of resources, at least in those two clinics. Delant, I have no idea. And Sutter, I have no idea. They probably do, but I'm just not aware of them.
Well, and hopefully in the new year, as we get further into 2025 and after Monday and all, that Open Door will still be a thing in this community going forward. That's the hope.
We can hope.
Yeah, we can hope. All right. Well, regardless of when you hear this, whether you're listening online later, if you hear it on KFUG the week after we record this, and whatever the weather's happening, right now it's beautiful. Go outside, get some sun on you, and enjoy, because we're having a nice dry January. So get out there and use it. If climate change is going to happen, we might as well find the bright side. And there it is, right out there. Ryan, thank you very much. Any last thoughts?
Absolutely.
Anything you'd like to add?
Yeah, go outside with a loved one.
Oh, there you go.
Right.
Okay.
Oh, there you go.
Go,
Much better.
go
Yeah.
pick up. Hey, go grab grandma, grandpa, take them to lunch, take them to the beach, get them outside, get some sun, right? Connect, or grab your kids, just anybody. Just reach out to a friend. Call, just build that community of support around yourself. It's so important.
Excellent.
But it helps me and my daughter, first staff. We have a competition, whoever sees the first daffodil. And
Oh, wow,
somehow
okay,
that
okay.
resets and we do better after
That's
that.
and then boom, it's spring.
Yeah.
That's
Yeah.
cool. Right on.
So that should
Well,
be coming up.
Lynn, Ryan, thank you very, very much. That's it for this week's Health Matters. Any thoughts about next week?
I'm thinking about talking about my concerns about RFK Jr.,
All right. Okay. All right.
of which there are many.
Yeah. All right. That will be the next Health Matters. Thank you, Lynn. Thank you, Ryan.
Yeah.